He's going to make a big impact, I think, on drug use disorder, which is important to me. I like Kennedy because he knows the stigma is the enemy of public health. He's not afraid to tell people that he used to use heroin. I know when I talked about my son who almost died of a fentanyl overdose because of contaminated cocaine, the Secretary of Health called me the next morning at around 6:30 in the morning, and he said, "Boy, you have courage." I said, "Well, Mr. Secretary, what do you mean you have courage? I mean, you admitted publicly that your son used drugs." I said, "I'm not ashamed of my son." I said, "My son has a medical problem and we need to get him treated for it." The problem is that, Mr. Secretary, stigma is the enemy of public health. All right. I don't need to stigmatize people. I don't like the word addict. I think it's a stigmatizing term. And a lot of these kids who use drugs use them to self-medicate because they're not getting the mental health services they need. Kennedy will take that on. And he'll take it on probably more effectively than any secretary has ever taken. And then, of course, he's going to go after the other chronic diseases that we have, as you mentioned, diabetes and hypertension, congestive heart failure, reactive airway disease. I think it's really great that he's focusing on chronic disease, and he'll make an impact. I just wish the media and those that have been against him would, as you point out, just help him succeed. He's just trying to make your family healthier. Why don't you help him succeed?